Good morning, everybody, and welcome to our Youth Employment Service webinar for July. My name is Mark Ashton. I'll be hosting you this morning. And for those who missed my initial introduction, I just want to remind you that a playback facility of this webinar will be made available. By all means, we are encouraging interactivity. Please post your questions in the chat facility or post your questions in the Q&A facility. We do want to be able to talk to you. There's nothing worse than talking out into the ether and hoping that somebody is listening. So we definitely want to engage with you, and hopefully we share a bit of good news around some of the innovation that YES has been involved in over the last couple of months and some of the success stories from our partners. Today, I'm going to be joined by Farai and Sarah from Youth Health Africa, who'll be sharing some of the initiatives they've been doing as one of the YES implementation partners. And then Shamila, who will be talking around the Blossom Care solution, which provides an opportunity to integrate YES into your ESD and SED initiatives. We've got some really exciting projects to be able to talk around there. So we really do encourage you to kind of look at YES and see it as a holistic solution as part of your triple BEE strategy, and also the way that we're able to engage with you on other elements on your scorecard. And maybe just a little bit of good news is I think we wake up to the news headlines this morning and over the last 72 hours, and it is hard. It is very difficult to be motivated. It's very difficult to be inspired, but there are some young South Africans doing amazing things. And hopefully this gives you an hour where you have an hour in your day to actually just sit back and absorb some of the good news that's out there, and some of the success stories that we're able to share. So looking forward to working with you and sharing this with you during the course of the next hour. And by all means, if you do have questions, drop them here. If you want to discuss anything offline, most of you will be familiar with me. But if you haven't worked with me before, my email address is nice and easy, and I'll be posting it into the chat facility. My email address will be mark@yesforyouth.co.za. In terms of the format, I'll be running through an introduction to YES, and then I will be running through the two various implementation partners, and then we will do some Q&A at the end of it. So it's not that we're ignoring any of your questions that come through. We just want to be able to deal with them holistically at the end of the presentation. So here we go. Thanks very much for your time. The focus for today is around the healthcare sector and ways that you as corporates can participate using your YES spend as part of a strategy to capacitate the healthcare sector. I think it's no secret that what we've been seeing around the country at the moment is a healthcare sector that's under pressure. Whether it is the kind of private sector, whether it is the community healthcare roles, whether it is access to things like sanitary pads, there's so many different challenges that the healthcare sector faces at the moment, and many people aren't aware of some of the amazing work that some of our partners have been doing through YES, where they've been able to do third-party placements into partners like Youth Health Africa, the Aurum Institute, the Blossom Care solutions, and hopefully today we're going to actually share some stories that inspire you to think a little bit differently. This, I think, has probably been one of the most kind of telling challenges that we've seen over the last, over the last 12, 18 months. But this is really the core of what YES is trying to tackle. I can't get a job without experience. I can't get experience without a job. And the challenge that youth find themselves stuck in is this inability to be able to actually get actual real world work experience. There's plenty of skills training around. Skills budgets are very extensive in terms of the BEE scorecard. It's this critical element about work experience that is so important to be able to talk through in terms of the professional development of the young South Africans that are out there. And I think when you start looking at these two projects that we're going to be featuring today, you'll understand how entrepreneurship comes through, that work experience, that social capital, and all these other elements that make up for a holistic work experience actually comes through the YES implementation partner model. Just a quick agenda that we'll be running through. I will probably push the hubs and the YES smartphones down to the end so that we can talk through some of the mechanics of YES. I really want to give the implementation partners the opportunity to talk around their solutions. But as I say, if you see something that's interesting or you've got a query, by all means, drop it into the chat facility and I'll be there to pick up the questions as we go along. So YES effectively provides a 12-month quality work experience to unemployed youth. The intent is to reignite South Africa's economy and give them that first critical work experience. Experience on a CV and a reference letter triples the likelihood of a callback within 3 months of a job search, and a reference letter doubles the chances of employment for women. Now, for many of us who are familiar or have gone through the corporate route, and we've really enjoyed the ability of access to something like LinkedIn or Career Juncture or one of the other typical recruitment platforms, we understand this concept of building a CV, the concept of having somebody who will give us a job reference. For many of the youth that are trapped in this kind of cycle of not being able to get work experience, unless they can actually get somebody who will put their name down and say that Mark has these skills to be able to go and execute on the job that you've looked for him, or looking to appoint for, they simply do not get their foot in the door. And I think that by the nature of the way that the employment situation in South Africa is, nobody is prepared to take chances on young South Africans, and we really need to try and reverse some of that mindset to be able to push through it. Effectively, we can combine the Yes BBE level up. So in other words, with Yes, you're able to get either one level on your BEE scorecard, one level plus 3 bonus points, or 2 full levels up on your BEE scorecard, while at the same time creating a work experience for young South Africans. Importantly, the definition of a youth in the Yes context is 18 through to 35. For the employment tax incentive purposes, it's 18 through to 29. But there are so many different ways that you can go and integrate Yes into your recruitment strategy. There's a misconception in a lot of ways that Yes is all about simply doing entry-level work. The definition of a Yes youth is certainly to tackle that intent of first work experience or early work experience. But the definition for a youth is 18 through to 35, Black as defined by the South African BEE codes, and unemployed at the time of contracting. It does not necessarily have to be somebody who has got no work experience. While the intent is obviously to create the work experience, it does not mean that somebody that has some work experience is precluded from partnering with Yes or being made part of a Yes cohort. Just in terms of impact, and I think that, you know, when we start to kind of look at some of the stats that have come out, particularly if you look at that NIDS CRAM survey and some of the things that have come out of the various data points in terms of economic data in South Africa, we really are looking to talk about impact. And the thing about Yes has been social and economic impact. So 57,612 youth as of yesterday afternoon had received a work experience through Yes. There are over 1,500 programs running on Yes, and there's been more than 3.2 billion rands of youth salaries injected into the economy. It sounds like you know, when we often get asked about this question about the million jobs, remember, Yes is just a component to it. And I think that when we start to talk about Shamila's project with the Blossom Care Solutions, you start to understand the multiplier effect of setting up small businesses, capacitating small businesses. But this is effectively some really big numbers in a kind of economic climate which has been incredibly challenging. Remember, Yes effectively counts this from 1 January 2019. We have COVID that came through in 2020, and then we've had the economic challenges of 2021. But just an interesting, and maybe this also just gives you a little bit of hope as well around the future for South Africa. February was the busiest month that Yes has ever recorded in terms of new corporate programs signing up. There's a couple of reasons for that. One, there was obviously a delay with some of the organizations kicking on from their 2020 programs. Many of them looked for dispensations from the DTIC, but also there's organizations who have seen their BEE scorecards disrupted through the likes of suppliers, that they've lost major suppliers, they've had ownership deals that have terminated, and we can see a lot of pressure, particularly from the mines and the big banks, putting pressure on their supply chain that they do require BEE as part of their requirements for their service providers. And I think this has been a big catalyst. And I think also just the general mood talking to sponsors in the last couple of days has been corporates want to do the right thing. They do want to create these work opportunities. And it is important that we look and say, well, what programs have got the scale and impact to be able to deliver over the long run? Interesting fact, and I quite like this one because we get asked about it quite often. For those of you familiar with the Yes legislation, it requires 2.5% absorption for a single level on your BEE score. BEE scorecard. The average Yes absorption is between 32 and 42%, which just tells you, the moment you give a youth a little bit of work experience, they're able to go and grow from there. Over 500 be level ups, and we've got organizations going into their 4th year of participation. For those of you who thought or remember the original expectations around YES, there was a concern that it was going to be very much a short-term incentive where organizations were simply going to look to get a quick level up on their scorecard. Organizations are returning on a regular basis for this program. And so I think we're now into our 12th organization that is in for its 4th year of participation. And that takes into consideration 2020, where COVID was a serious issue. For those familiar with the YES program, the youth get their mobile smartphones. 8.9 million minutes of learning minutes have been delivered on the smartphones over since we measured that from 1 January 2019. So youth are using the smartphones as a monitoring evaluation tool. We supplement this with an inbound and outbound call center and corporate support line to be able to assist the youth during this period. And that'll be everything, both the youth and the corporates, but primarily if the youth are looking from a monitoring evaluation perspective, we can assist them with looking at their employment contracts. We can assist in terms of whether they are on a learnership, an internship, a YES program. There's so many questions that come out from these youth, and we do provide them with that resource to be able to work through it. When the youth are employed through the YES implementation partners, we have our own Farai who developed a scorecard for these implementation partners, and they are rated on everything from absorption through to understanding of the BEE legislation, to the quality work experience that is delivered, and the opportunities that they ultimately produce for the youth on top of the basic quality work experience. It's a literal who's who in terms of who is participating in YES in terms of big corporates. Interesting trends that we're starting to see coming through now is very much the technology sector is adopting the YES incentive. We're seeing a lot in the healthcare sector. Multinationals love YES from an ownership, in terms of dealing with the challenges with ownership. We've then had a equity equivalent program, which is run as part of a YES implementation, and happy to discuss that as an offline discussion. We've had quite a lot of engagement with the DTIC and the other stakeholders. And, it's one of the things I really do want to emphasize is that YES works very closely with the entire BEE ecosystem to be able to provide resources for corporates that are looking to say, well, how do we integrate YES across my entire scorecard and build it out? And if there is something like an equity equivalent, we're certainly happy to go to your meetings with the DTIC, work with your consultants, and see what we can build out there. These are just some quotes. I'm not going to get too stuck on them. I will be sharing this in the entire presentation with you after this. But it really does just talk about the buy-in from business leadership in the country. VWSA have run regular programs with YES across both an implementation and internal partner model. Nedbank have just returned for their 2nd year of participation. You will often see them participating in mentioning YES as part of their program. And interestingly, Nedbank is one of those organizations that participates as a level 1 organization and are doing it as a big part of tackling some of the social challenges that South Africa faces at the moment. This is very much just the boxes that YES can tick in terms of its different placement options. So one, you've got the YES triple BE incentive. We can assist with enterprise development. We've got some skills programs, socioeconomic development. And what people often forget is YES is also established as a not-for-profit company and PBO, public benefit organization, which allows us to issue Section 18A certificates. So we can tap at both your tax incentives, but also your DTIC and triple BE incentives. So please don't forget that. We just had a very generous donation from one of the corporates, which is being used to capacitate one of the YES hubs, and they're doing that from a Section 18 perspective. So don't forget it. We love those kind of donations, and we know that we can put them to work in terms of job creation initiatives. I'm not going to get too much into the math around calculating your YES targets. I had a quick skim through the RSVP list, and the majority of you are familiar with the YES targets, but I am happy to take this discussion offline if anybody needs assistance with calculating their YES target. There is a score, there's a calculator which is on the website. There are effectively 3 numbers that you need to be able to have on hand to calculate your yes target. That is your headcount at the end of the last measurement period, and the revenue at the end of the last measurement period, and then your 3-year average net profit after tax for generic entities. I will come back to this if there are any specific questions at the end of in the Q&A section, but I am going to try and jump forward a bit just as I am cognizant of time. In terms of the benefits that YES brings to an organization, it's obviously bringing fresh new ideas and skills into your business. You can try out different youth in terms of whether, we have a very good story, for instance, with one of the multinational technology companies, and they actually made a big push in their 2020 year to recruit at least 1/3 of their cohort through as being differently abled youth. And these were recruited through an implementation partner and then actually given permanent employment opportunities inside of their organization. One of the big challenges that many small businesses face, or many businesses face, is being able to develop a strategy for recruitment of differently abled youth. So this is a nice way to be able to look at those opportunities. There's build and support SMEs and entrepreneurs, create future capacity and taxpayers, and become a driver of economic opportunity and activity in South Africa. I'm primarily going to focus on the YES implementation partner model for the purpose of this presentation. The purpose of the YES implementation partner model is to assist organizations that are unable to host youth internally, but would still like to participate in YES. And there's a couple of things that I really just want to touch on high level there. Your YES target does not have to be appointed inside of your own organization. You can make use of an organization such as Blossom or Youth Health Africa. And it's quite a popular, and just in terms of the contracting framework that's involved here, many people think that your YES youth have to appear on your payroll and have to appear on a co-employment agreement with you, and that's incorrect. The most popular contracting framework actually involves two-party employment contract. So if we use the example of Youth Health Africa, the Youth Health Africa will be the employer on record for these youth, and they will also be the administrator of the payroll. So the employment contract will reflect Mark and Youth Health Africa. Some corporates do want to be involved as a co-employer, and we can accommodate for that, but the most common typically is a two-party employment contract where the payroll is administered through the implementation partner. And the reason for this is, one, it doesn't mean that it means your headcount doesn't expand further. It means that you don't, and then have a knock-on impact to the rest of your skills and headcount returns. But also it means that, some organizations don't want to be directly involved with their youth. Other organizations want to have a very proactive relationship with their youth. And I'm happy to kind of take you through any more specifics that you want to discuss around that. But that just gives you a high-level overview of the YES implementation partner model and some of the ways that it can be activated. With that, I'm going to kind of pause on in terms of the mechanics of YES. I think the reason most of you are here today is to hear a little bit about the success stories of the YES implementation partners and the types of work that they're creating. And I'm going to be handing over to Sarah and Farai. Initially, they're going to take you through the work that Youth Health Africa is doing, what the organization is involved in. And from there, I will then move over to Shamila, which will talk more about an entrepreneurship and SME model that's doing some very interesting things, particularly in conjunction with the YES hubs. And from there, we will go into Q&A. So I'm looking forward. I can already see some nice questions coming through on the Q&A facility. So I'm going to be keen to engage with you as you go along. Farai and Sarah, I'm about to jump to your first slide. Are you good to go from your side?
Yes, perfect.
Great. Give me one moment while I pull up your slides. All right, and the floor is yours. I will move your slides as you're going along. Shout if you want me to go forwards or backwards, but over to you, ladies.
All right, perfect. And I think first and foremost, thank you so much, Mark, for the platform. And I think more than 460 days into the national lockdown, it's such a prime time to reflect on the state of our healthcare system and also what the impact of investment made into it now will have on our post-pandemic economic landscape. I think that the inception of Youth Health Africa was really mandated by some of the challenges that you had already spoken about and that have become so pronounced now with COVID-19, and that it is, and that's that the South Africa's healthcare system is heavily overburdened, and it has been for a very long time, long before COVID-19. The healthcare system is drastically understaffed, and this is despite the incredibly high numbers of youth unemployment in the country. I think that many challenges with human resources, especially in the healthcare system, lie in the misunderstanding of various roles that are required in the healthcare environment. A lot of times we're under the perception that jobs in healthcare revolve around more clinical expertise, whether it's around nursing and radiography or doctors and dentistry. However, I think that for an efficient healthcare system to be built and grown, some entry-level roles look like data capturing and administration or patient navigation. And these are really the skills that don't require super specialized training. At Youth Health Africa, our goal is to address youth unemployment by training young, disenfranchised youth with these entry-level skills and to then staff our healthcare system. We like to see ourselves as a leading youth empowerment organization that harnesses the work of the future. We have more than 2 years experience in the field. We've run youth internships across the country. We have a national footprint. So we're working in 8 out of the 9 provinces, except for the Northern Cape. We have really great standing stakeholder relationships with the healthcare implementing partners that work with the Department of Health, with government, with funders, and with various training providers and communities. We are a multidisciplinary and multinational team. We are youth-led, and I think just some of the impact really high level is just that we've had more than 2,250 youth on the program since inception. We have a retention rate of 94%, which means that 94% of the 2,000 plus youth that have come through this program have successfully completed their internship with us. We have more than 40% absorption rates, where young people are being absorbed either straight into our healthcare partners and the Department of Health, or different opportunities that we have been able to create pathways for. We're currently working in over 1,100 communities, and just really, I think Sarah would definitely speak more about some of the individual success stories with some of the youth that have come into this program. But I think in the 2 years that we have been in existence, we've really seen such a great strengthening of the delivery of healthcare services that we provide our partners. So I'm just going to hand over to you, Sarah, for the next few slides.
Great, thanks so much, Farai. Yeah, and I think that through working over a period of just over 2 years, Youth Health Africa has really been able to strengthen our processes to ensure that young people gain meaningful work experience, to enable them to gain skills to enter the job market permanently, and also that we make meaningful contributions to the public health sector. So I'll just take you through some of our key program components. Our recruitment process has become very streamlined, and we work very closely with multiple stakeholders, especially around the Department of Health and the community. And in placing young people, it's so important that we place youth close to where they live, that there's no additional money spent on transport. We've also been running really exciting programs with an organization called EDEF, where we're able to place deaf candidates in the health sector, which has been a really integral part of our recruitment. Youth Health Africa also has a unique and intensive training program that's both designed in-house and implemented with our various health implementing partners. So we roll out our intensive work readiness training, and our team has been really fantastic in being able to transfer some of these training models online and into online virtual training rooms in light of COVID, especially because, as Farai said, as our health sector is becoming more and more strained, it's so important that the youth are able to get into the field and be kept safe and know the expectations of their work. And our healthcare implementers provide very intensive technical training, depending on the role the youth is placed in, whether they're a lay counselor or a data capturer. And we've got a very wide variety of roles youth work in. I think during the program, during the 12 months, we keep a very intensive performance management program running, including KPIs, which our supervisors submit to us on a monthly basis, which are then analyzed. Poor performing youth are then able to receive personal one-on-one attention through site visits and interventions. And then, as Farai spoke, touched on, our absorption team is so critical to the sustainability of Youth Health Africa and internship programs in general. And it's so critical that young people are able to get the support they need to enter the job market permanently, and more to start their own businesses. And Youth Health Africa's training team has developed a really in-depth entrepreneurial training course and is looking at how we can leverage seed funding for youth to start their own businesses, and hopefully then have other Youth Health Africa youth employed there. And then we spend about 2 years tracking our alumni, making sure that they're still employed or if they have gained access to employment. I think just before I move off the slide, the work we've been doing with COVID has been really, really exciting. With a cohort in the Eastern Cape funded through YES, working on COVID vaccine registrations for elderly people and creating demand. And through that small pilot, we've been able to leverage more funding to create demand for vaccinations and ensure the public is confident about the vaccination process. Mark, could you go on to the next slide? Thank you. And then just some of our impact. Farai spoke a lot about our footprint, but we've currently also looking more into the research side. And there's currently 2 studies running. A study looking at young women who are at risk of contracting HIV through a USAID partner, as well as a global TB study that's happening across the globe, where we have a lot of youth placed, and then more and more looking at the COVID vaccine rollout. I think I've touched on training. We are in the process of developing our own seated training program, which has been really exciting. And I think we've, during the pandemic, have really leveraged and acknowledged how important digital media is in reaching young people. And we have almost an organic reach of 2 million, which is so important in creating these different pathways for youth to gain knowledge. I think that Youth Health Africa aims to work through co-creation. I think is a word that we like to use a lot. Just working on sustainability, youth development and healthcare roles, and making sure we align with different partners. And then you can move on. Thanks, Mark. I'm conscious of time. Youth Health Africa has maintained a pipeline of just over between 2,000 and 3,000 youth in different provinces to ensure that we're able to continuously find employment for youth and strengthen the healthcare sector. And then the final slide. Yes, I'll quickly talk about 3 really incredible young people who were all once YES youth. Mbali is currently working with us as a project manager on the Youth Health Africa team. And she was previously sponsored by VW and now plays a critical role in the growth and expansion of Youth Health Africa. Cassius was employed as a lay counselor and HIV self-screener with Aurum, and he was performing so well. Aurum CEO came out to the clinic to ensure that Cassius could be showcased to the work young people do. And then finally, Priti Sibonyoni, who's also a youth who we always showcase, and she works closely with our team and manages a huge network of partners, and was once on the program herself, also sponsored by VW. So I think to see just 3 of these young people thrive has been so exciting, and we can't wait for what the future holds. Thanks, Mark.
Thank you, Sarah. Thank you, Farai. I think one of the, we always talk about this head and heart element when we talk about yes and yes implementations. And, if I put my BE cap on and I'm calculating targets, we often look at it like a spreadsheet exercise, but I think it is so important to be able to share these success stories, put real names to it, to show that there are absorption pathways, there are organizations that are creating meaningful work with social impact. And I think that is really important to be able to actually put names to it. It just changes the dynamic and makes this entire project more worthwhile and a bit more real. And like I say, one of the big shifts we've noticed, that's happened over the last couple of, probably the last 18 months specifically, and I think it's been very much driven by the YES implementation partner team, but also it's in the understanding with the other YES IPs, has been this relationship between the corporate funder and the implementation partners. Very much in year 1, it was a fire and forget approach where we would quickly create a few jobs. We're doing it for a little bit of BE compliance. And I think what has materially changed has been the way that corporates have seen the impact of the work that they do. When they can go and they can see somebody develop, they can see an opportunity to fund their business, they can see an opportunity to go and kick off with some skills programs. And really that I think is one of the key takeaways from today, is to encourage you to look at this as kind of a holistic solution with multiple elements. Look at this over a couple of years. Don't just look at this as a short-term incentive from a BE perspective. Shamila, I'm about to move to your presentation. Are you ready to roll from your side?
Yes, all good to roll.
Cool. Give me one moment. I'm going to pull up your slide. All right. And with that, I'm handing over to you.
Thanks, Mark. Thanks for this platform. It's good to be here this morning. Now, we've barely survived 16 months of a brutal pandemic where so many people have lost their jobs and their businesses. We've lost close family members and colleagues. And just when we thought things couldn't get any worse, we have the civil unrest that has gripped our country over the past week. Now, sure, there's the politics behind it, there's the criminal element, but I think it's also very symptomatic of the broader societal issues that we are facing as a country. And this only strengthens my resolve and makes me more passionate and determined about the Blossom Project and what it is that we wish to accomplish. Now, who are we? We consider ourselves to be a mission-centric social enterprise, and we really exist to solve the 3 following problems. So we look to improve access to sanitary pads amongst young girls in township markets. Now, just to give you some of the stats, research done by Africa Check in 2016 found that 2.6 million young girls in South Africa cannot afford to prioritize the purchase of sanitary pads. A further 1.8 million are occasional users. Now, this has massive knock-on effects because it means that 30% of girls in South Africa do not attend school when they're menstruating. Now, menstruation, which is something that is so natural, is then a driver of gender inequality and disempowerment. And it poses barriers in a woman's ability to engage in education, the work environment, the enjoyment of guaranteed rights such as reproductive health rights and sanitation, equality and dignity. This has ripple effects then on economic development of communities and the country as a whole. So improving women's health is essential to reducing poverty and to fostering economic growth. Now, the second problem we hope to address is the rampant unemployment that we're currently experiencing as a country. It's one of South Africa's most intractable challenges, which has been made even worse by COVID-19. Now, we're currently sitting at 62% of youth between the ages of 18 to 35 that are unemployed. Now, Blossom aims to create jobs that are sustainable, and we do this via a deliberate women-centered approach. Now, why the focus on women, you ask? More than 40% of South African mothers are single parents, and we hope that by empowering women to look after themselves and their families, they can then be better mothers and guardians for future generations. The third problem we wish to tackle is the creation of small and Black-owned businesses. And by doing so, we wish to stimulate local economic development. Now, we believe in the power of small businesses to reduce inequality and create jobs. And this is recognized as a key to stimulate inclusive economic growth and transformation. How do we do this? We have a three-pronged approach. We focus on people, profit, and our planet. You can go to the next one, Mark. Now, what we do is we have a micro-franchise model, and this is used to identify 6 unemployed women between the ages of 18 to 35. Now, we've developed a process that maps out the journey that these women will go through to develop them into an effective team. Now, the process starts with us identifying a location. We then go into the area and develop an understanding of the local environment. We meet with key stakeholders. This is followed by information sessions that explain the project to the community. Jobs are advertised and boot camps are hosted with applicants that profile and select a short list of candidates. Now, once these 6 ladies are selected, we then develop them so that they are able to run a sustainable business. And this is a key priority for us. The young women who eventually graduate to become entrepreneurs, they have a supportive and structured environment that's provided through franchising. And this includes ongoing mentorship and coaching, and it's aimed at developing each individual franchise into a larger, more sustainable business over time. Next slide, please. Now, a total of 75 days of the first year is dedicated to training our youth. The learning and development program is quite holistic. So you can see it includes vocational, EQ training, and personal well-being. The training methods include a mix of on-the-job learning. We've got digital learning and workshops. We have a full-time business coach employed on the premises, and the business coach is really responsible for overseeing the development of the 6 women, but also monitoring and evaluating the performance of the business. The staff are monitored against personal as well as business KPIs, and these are measured and monitored throughout the 12-month program. Next slide, please, Mark. Now, our profits. Blossom is quite a disruptive solution. So a small-scale, low-cost manufacturing setup. We have decentralized manufacturing plants. They are ISO compliant, designed by Blossom, producing 360,000 pads a month. Now, what this really means is that we locate and we integrate into local value chains. So the factories are able to meet demand in their immediate locality. Staff can often walk to work. Distribution channels are local retail and wholesale businesses and beneficiary organizations like schools. And this really shortens the supply chains and reduces costs dramatically. Now, we offer a range of product that includes both biodegradable and standard sanitary pads. 80% of all our raw materials are sourced locally, and we plan to transition this to 100% locally sourced materials by the end of 2023. Now, the problem currently in the sanitary pad market is it's dominated by the larger FMCG companies, and this is supplemented by imports. Now, these traditional legacy-based business models means that businesses are not geared to efficiently supply products into these markets where they are most needed and at the price point that will increase access. Next slide, please, Mark. Now, our planet. Feminine care products generate 200,000 metric tons of waste annually. Now, this is evidenced by the growing landfill issues that we're facing today. Now, waste can take between 500 to 800 years to decompose. And as the costs of biodegradable materials reduce and become more easily accessible, we plan to convert all of our manufacturing to 100% biodegradable. Now, the current costs to source compliant biodegradable material makes it very difficult for us to compete commercially. And this is why we have the mix of biodegradable and the standard sanitary pads. All our factories are installed with solar panels as the primary source of power, and with responsible sourcing and responsible partnerships, we will ensure that by the end of 2026, we'll reach our goal of being completely carbon neutral. Now, this shows our footprint that we hope to achieve by the end of February next year. We are currently located at Saldanha Bay and Tembisa in partnership with YES at the YES hubs. And we've got quite an aggressive rollout planned of 7 factories to be located nationally within the course of this year. Now, how do we get in? How do funders get involved? You can do it through your ED and SD spend by funding a complete micro franchise, and this includes the salaries for the 6 youth during the first year. It then allows you to claim job creation points. You can do it through your SED spend by the funding of offtake agreements. This supports the franchises through sales, and distribution is to Black beneficiaries. You can do so via a combination of 1 and 2. You can do so by funding of youth salaries for BEE via partnership with YES, and funding of training and development for skills development points. Now, we have quite an extensive M&E framework in place, and this includes monthly reports, regular project reviews, and post-project impact reports. And these all support BEE audit requirements so that it ensures that funders obtain the full value and points for their spend. Now, we are quite active on social media, so you can find us on Facebook, Instagram, and Twitter. And further inquiries can be directed to me, Shamila at blossomcare.co.za. Thank you all for your time.
Thank you, Shamila. And it's very nice to be able to share a success story. I think we are crying out for them at the moment. I'm going to jump to the Q&A facility. I see there are some questions and answers that are coming through, and I'd like to answer them as they've arrived. Shamila did also reference the YES hubs. So I'm just going to quickly jump back in the presentation just to give you a sense of what those YES hubs look like and some of the applications and projects that are involved there. And then I will give you the opportunity, and then I will look at answering some of your questions. As I say, there are currently 3 YES hubs that are in action at the moment. The first one is the Genesis Hub in Saldanha. The second one is the Alusha Hub at the Alex Mall. And just as an interesting insight, I mean, we've obviously been very much on the ground in terms of understanding what has been happening in the community at the moment. And this is one of the sites that has not been exposed to any of the what's been happening to the communities. And then the third one being the Tembisa hub, which is actually in the process of being relocated at the moment. So for those of you who've been involved with the YES project over the last couple of years, you'll be familiar with some of that imagery. But effectively what the intent here is to be able to create programs that create jobs inside of communities, not necessarily, one of the big challenges we have as South Africans is lack of social mobility, the ability to move to and from different work experiences. Just the cost of doing a job interview, getting to and from a job interview can be prohibitive. So the intent behind these hubs is to create new jobs, and actually they're quite cool jobs. Shamila mentioned the Blossom solution, which is either bolted onto a YES hub or it can be bolted onto a mining or manufacturing operation. These are just some of the other jobs that are being created there. There's an aquaponics, agriculture and aquaponics facility. There's hospitality activities. There is 4IR training facilities. There's a drone academy at the Saldanha hub at the moment where a number of youth are being trained in drone pilot training. There's a 3D printing facility at the Alex site at the moment. There is the Blossom manufacturing facility. There is a CMT facility. So one of the requests that's coming through is for us to be able to put together packs which incorporate things like the sanitary pads, but also to use the CMT facility to make face masks or to make school bags as part of projects. So all of these create work opportunities for these youth. And this is why I'm saying there's always opportunities to integrate this as part of your broader spend. And I mean, this is just talks a little bit about some of the projects there. I am cognizant of time, so I am going to jump to the Q&A facility and answer some of the questions that have been coming through at the moment. But if you do have any questions, you're welcome to post them in the chat. I'll be able to address them as well as they come through, and we can then go and kind of take any further discussions offline as they're going. So first question that's come through is the employment tax incentive. Can you claim the ETI as part of your YES initiative or YES implementation? The answer there is yes, you can. There's a couple of considerations that you do just need to be aware of. The employment tax incentive, for those who are not familiar, is a SARS incentive, and it rewards organizations for creating youth jobs. Just remembering, as I mentioned, that the YES age group was 18 through to 35. The 18 through to 29 is the SARS definition of a youth. Now, remembering some of the insight that we've picked up along the way is organizations that make use of the employment tax incentive but work through third-party implementation partners such as Youth Health Africa or Blossom Care Solutions. One of the challenges is that SARS pushes back and argues, are these youth working for the benefit of your organization if they are appearing on your payroll? So remembering, I said right up front that there is the option to either have a 2 or 3 party employment contract. If the youth are on your payroll, you should have no reason why you can't claim the employment tax incentive, but we always encourage you to be able to seek professional tax advice before claiming the ETI. In the situation where you have a 2-party employment contract, where the youth appear on the implementation partner payroll, there are a couple of ways in which you can tackle this. One of the options is to let the implementation partner claim the employment tax incentive as part of their rebate. And some of the implementation partners prefer that. It just, in terms of cash flow, it works for them. The other option is to run a mirrored payroll, where you can coordinate a mirrored payroll with the implementation partner. So there are ways to look at incorporating ETI into your spend, and it isn't prohibited in terms of any legislation that is in place at the moment. Question about whether or not I'll be circulating the presentation. Yes, I will be. I will circulate to all registered delegates, including those who were not able to attend. There will also be a playback facility plus a YES BBBE booklet. And if any of you want any feedback or have specific questions, we'll certainly address it there. Is the opportunity for new implementation partners to join the program? Maybe if I could just kind of qualify that statement, there is or question, there's often a perception that YES takes youth and provides free labor to implementation partner, to small businesses or corporates. We've had security companies, for instance, saying, please, can we provide them with free youth to come and work in the organization? That's not the intent behind the YES implementation partner model. An implementation partner is typically a not-for-profit organization that is established for community good. So if you've seen the two presentations today, they will tick that box. There could be the potential for them to be a for-profit entity, such where the intent is stability and they're generating small businesses. Absolutely no problem with that. But it is not an intent to capacitate things like call centers or security businesses or private education initiatives. The idea is, yes, implementation partners are incorporated as part of a very strict measurement framework. The question around can I place my youth in places that are not YES implementation partners? Yes, certainly you can do that. All you need to do is be able to show your verification agency a flow of funding where you created these youth jobs. We obviously encourage you to make use of the implementation partners from a monitoring evaluation perspective, but that is obviously something that you work in as part of your broader strategy. We've seen some situations where YES youth are being deployed to subsidiaries or to suppliers or enterprise development programs, lots of different ways to be able to cut it. Can a for-profit social enterprise be incorporated as an implementation partner? Always happy to review it. We talk, obviously, the kind of key metric there. I think there's currently 35 that are on that jobs menu at the moment, and depending on capacity. But by all means, always happy to discuss strategies around incorporating that. At the end of the day, the challenge remains that we need corporates to fund those positions. YES doesn't go out there to go and kind of bring funding in for your organizations. It's a symbiotic relationship where we all support each other. Are there any other questions that I have not addressed or you'd like to have addressed? A question that's come in here just over email. Can I engage Blossom for a standalone facility? Yes, you can certainly engage Blossom for a standalone facility or co-funded facility. We've seen it with some of the mining groups at the moment, and they are certainly looking at that as an opportunity to create new work experiences. What else have we got here? Community engagement. I'm just going to try and summarize this question just because I'm cognizant of time, and I know that both Shamila and the YHA team did touch on this. One of the big challenges of creating work experiences inside of communities is particularly that are outside of your traditional Gauteng and Western or kind of Sandton and Cape Town type environments, is that it does involve an element of social interaction. It is stakeholder interaction. We had the YHA team will be familiar with this. We had a project that's just kicked off in an area where there's incredibly high community tension. And the situation in literally, if you were on the wrong side of a road, you weren't considered as eligible for a particular project. There are very specific community boundaries that are in place, and those were the YHA and Blossom teams have all been involved in projects like that, where there is community engagement, and it is part of the value add that partners like this bring to the party. There are verification agencies that do not allow for YES benefits to flow from companies with zero Black ownership. Can you give us more information about how multinationals can participate and meet the sub-minimums? The answer is, if you have zero Black ownership, you can participate in YES, and this is quite an important consideration. We're always happy to take this offline and say, I've mentioned the equity equivalent as an opportunity. But there is also remembering that the legislation says achieve a 40% sub-minimum across the priority elements or a 50% average. And that's important when you look at that practice note in Gazette, is to specifically look at the 50% average. The big question that often comes up is whether it is clean ownership or whether it is, what do you call it, net value ownership. That does get scrutinized quite a lot, so just be aware of that. Always happy from a yes perspective to chat to your verification agencies and talk through the yes strategy. It's a big part of what we believe is value add, is that we do actually engage with the stakeholders. But the high level answer to that is yes, you can participate without black ownership as part of the matrix. What else can we tell you? There's a question here about change of leadership. Some of you will be aware that Kashmir has stepped down as the CE of Yes. Communication has been pushed out over the last last 3 months, just kind of giving some heads up that this was taking place. The Yes CFO, Vaughan Kelly, and the Chief Client Centricity Officer, Leanne Emery, are appointed as co-CEOs for this role at the moment, and further communication will follow in that respect. I don't see any other questions that are coming through. Here's a question. There's 2 questions here that I'm also just going to quickly run over here. The first one saying, can we participate in Yes if we are currently not rated? The answer is yes, you can. Remember that Yes is always additive. You take your rating that you achieve in your first year and you put Yes on top of that. So if you make the sub-minimums and you achieve the rating, you can put Yes on top of that. One thing, and I'm just going to try and put this question together just because I can see it's been asked in a couple of different ways, is this question about new jobs and the kind of analysis from a verification agency perspective. So if you remember the original intent around Yes, it was the creation of new work experiences and new jobs. But in terms of the FAQs that are approved by the DTIC, they say that this is not measured. However, and I caution this just because I've been involved in a couple of discussions over the last few months, you cannot take what we have seen some organizations doing is they have been trying to execute Section 189s on their staff and then rehiring them as Yes Youth. That does not go down very well with the verification agencies and is not in the spirit or intent of the legislation. And I caution anybody against doing that. I also caution anybody about terminating contracts before the end of the 12-month work experience. The headcount, and this is just a piece of guidance, and you obviously engage your verification agency around this. Your headcount at the start of the measurement period and your headcount at the verification point, do just make sure that you have not got a situation where you have a sharp reduction in headcount. We had an organization the other day which had 40 at the start of the measurement period and 39 excluding their Yes Youth at the end of the measurement period. And the verification agency did put a lot of scrutiny on that. So just be aware of some of your HR activities and headcount activities there. I don't see any other questions. So with that, I'm going to say thank you very much for your time. And thank you very much from the, this is a question that I have seen come through quite often, and I just want to address this because it comes up quite often. The question is, can I terminate a Yes contract in month 9 to make the Yes Youth permanent? And let me just quickly frame that. Yes contract is a 12-month fixed term contract. The Yes Youth, if they drop off before month 8, they have to be replaced with a new 12-month contract. If a youth drops off after month 8, they do not need to be replaced. And this question comes up quite often. You train up your youth, they start their work experience, they get a little bit of social capital, they build out their LinkedIn CV and start shopping their CVs around. There's nothing to say that you have to leave your youth on the national minimum wage. You can certainly offer a permanent employment contract in month 9 if you choose to do it. You can either run it as a parallel contract, or you can run it as a contract that kicks in the 13th month of their engagement with you. There are a couple of different ways to deal with that, and I'm happy to take that discussion offline as well. It's you can drop me an email. It's Mark, M-A-R-C, @yesforyouth.co.za. With that, I am cognizant of time, and I'd really like to just say thank you to our panelists, that they are for giving up their time and sharing some of the work that they do. I think there has been a lot of challenges in South Africa and in society in general. We all need a bit of good news, and just to see the type of work that the organizations are doing is it is heartwarming, and I think it does give us a sense that there is good news to be shared there. So to Farai and Sarah from YHA, thank you very much for your time. You are always rockstar partners for us. You always help us out when we need something, so thank you for that. To Shamila, you do amazing work, and I really do appreciate the opportunity to be able to work on projects with you. And just to say thank you to our guests. You gave up an hour of your time when things are challenging, and we really do appreciate and value the contribution you make to the YES ecosystem. On behalf of the Youth Employment Service, I really just say yes. Thanks very much for your time, and we look forward to engaging with you after this webinar. Thank you.